Third Street Youth Center and Clinic is a CBO located in Bayview, Hunters Point, San Francisco. This CBO targets the young population of this neighborhood, which are individuals between the ages of 12 to 24. Bayview Hunters Point is a low-income community of color. There is a lack of access to health care, high rates of crime and substance abuse, and low education rates. In 2019, the median household income in this neighborhood was $75,390, and 19% of children under the age of 18 live in poverty in this neighborhood. 13.9% of the total population live below the poverty line, and this rate is 20% higher than the rate in California, which is 11.8%. This population is also ethnically diverse. 48% of the population is Asian, 26% Hispanic, and 15% is Black. And as we have learned as public health students, there is a strong correlation between your income and your health outcome. One can even say that our socioeconomic status is the strongest predictor of one's health and life expectancy, because good wealth equals to good health. Low-income families typically live in disadvantaged urban or rural areas, have poor diets, experience more stress, lack exercise, and don't have or just can't afford access to resources, which all results in poor health outcomes. Healthy People 2030 AH01 objective is to increase the proportion of adolescents who received a preventive health care visit in the past year from 78.7% to 82.6% by 2030. Their AHDO2 objective is to increase the proportion of children and adolescents with symptoms of trauma who get treatment. Lastly, the AH03 objective is to increase the proportion of adolescents who have an adult they can talk to about serious problems from 79% to 82.9% by 2030. Third Street is a community-based nonprofit organization whose funding comes from donations. This organization strives to help the young residents of Bayview to become successful adults and to flourish. They help ensure that this vulnerable population has access to healthcare, employment, and education by providing a wide range of holistic services. They first opened in 2005 and were run by a group of volunteers which consisted of neighborhood parents and upstanders. They offered health education and arts programming over the summer months, and now they have a full-time staff who run their many programs along with volunteers who also assist with their youth. Their mission is to help youth ages 12 to 24 from Bayview Hunters Point make healthy and safe decisions that improve their physical, emotional, and social health, empowering them to become successful, contributing adults. Their vision is to build a more equitable world where the color of a person's skin is not a risk factor for chronic disease, homelessness, and economic instability, and that youth from all San Francisco neighborhoods lead happy, fulfilling lives. The services that they provide are a full-service primary healthcare clinic that offers free youth physicals, refers for specialists, STI treatment, rapid HIV testing, and pregnancy testing and counseling. They also offer therapy and clinical case management and housing services. Some educational programs that they offer is Third Street Leadership Academy, Youth Outreach Squad, and a summer health education program. They market these programs and their services through their websites and on their main social media platforms, which are listed below if you would like to keep up to date with their programs. One of the programs that are currently being implemented at Third Street is the Youth Outreach Squad. This is a 12-week program that is operated during the fall and spring 3 times a week. Applications are put out for the youth between the ages of 12 to 16 to apply, and 15 youth are selected for each age. It offers comprehensive mental and physical health outreach training where youth learn about sexual health, nutrition, healthy relationships, and how to manage their health. They are also taught how to demystify the medical system, and they raise awareness on the relationship between poverty, violence, and chronic poor health. The goal of this program is to help youth build long-term life skills by educating them on health topics. They also should be able to work with their peers and be educated on weekly topics. Participants also receive a stipend for their time. Ashia Coleman overlooks this program, and she says there is a 98% effectiveness with youth retention and 98% attendance throughout the 12 weeks. Also, 100% of the youth want to return for a second or third time. In order to interact effectively with this target population, one should have a positive attitude, compassion, respect, and perseverance. One should also be understanding, empathetic, and be culturally competent so you know how to approach cultural barriers. This CBO has a board and team members who represent their community and population. Misty Patton is a Bayview Hunters Point native and she is the director of 3rd Street. Joy Jackson Morgan is a second-generation Bayview Hunters Point native and she is the executive director of 3rd Street. If you would like to get more information about the CBO, their contact information is below. You can also email the Executive Director, Joy, for questions about 3rd Street and Aisha Coleman for more information about their health education programs. Thank you.